All right, the rotator cuff. So the rotator cuff is a group of 4 muscles that sit on the front and the back of your scapula or your shoulder blade with the function of keeping the humeral head or the top of your arm bone centered in the socket within the shoulder, whilst also assisting in movement. The rotator cuff improves stability within the shoulder via the tendons that attach those 4 muscles onto the top of the humerus. These muscles provide a medial or inward towards the body force, which help accurately position the humerus in the what's called the glenoid fossa, which creates a ball and socket joint. Okay, so these 4 muscles have some funny names, and one of those being infraspinatus, which means below the spine of the scapula, which you can see in a photo here. You'll also see just below that is another muscle of the rotator cuff called teres minor. And so these muscles are on the back of your scapula, and they're going to help externally rotate the shoulder. So movements of moving the shoulder outwards, or from this 90-degree position, moving it up. Now, infraspinatus has a twin, supraspinatus. And can you guess where that would be? Above the spine of the scapula. So just on the top of your scapula here, and that helps with movements of abduction. So moving the arm away from the body. So it's essentially like a lateral raise movement, just moving to the side, that'll help with that. And the last movement, the last muscle is subscapularis, which is on the front of the scapula. And that's going to help with movements of internal rotation of the shoulder. So just the opposite, moving in, and from this position, you move down. So how does the rotator cuff get injured? The rotator cuff can be injured from a single traumatic event, like falling on an outstretched hand and arm, where the shoulder lands in a bad position, or what's seen more commonly is just simply overuse or natural degeneration processes in the muscles and tendons of the cuff. As we age, these muscles and tendons in the rotator cuff naturally start to degenerate. It happens in everyone. However, other comorbidities such as having diabetes, being over the age of 50, or having an occupation where your shoulder and arm are constantly over your head, like a painter, where those muscles are going to be active more often, then that increases your chance of having an injury within the cuff. Eating healthy, following appropriate physical activity guidelines for your age and individual self, trying to get good sleep, and trying to cut out the use of cigarettes and alcohol in your daily life will help to reduce your risk of tendon and rotator cuff injuries and premature degeneration. All right, so as you elevate your arm, there are 3 spaces within your shoulder that are naturally going to decrease in size. This reduction in size is caused by more structures like bone being present within the shoulder joint and higher up, and they can compress things like muscles in the rotator cuff and cause pain. So one of these spaces that can be compressed is called the posterior-superior space. So that gets compressed in what we call the stop sign position. So that's some abduction that we talked about before, and external rotation. And when we're up here, if we go into some extreme ranges of external rotation, that's going to compress those muscles on the back of the scapula. Good job if you can remember them. They are teres minor and infraspinatus. And extreme pain there could possibly indicate a rotator cuff muscle injury there. Another one is just in some forward flexion, and we're going to push down on our arm, just internally rotating. That'll be winding up the muscles on the front and the top of your scapula. That could also be indicative of a rotator cuff pathology there. And just generally, if you're getting some abnormal pain in those movements we talked about before, external rotation, abduction, or internal rotation, then that could possibly mean there's a injury to the rotator cuff. But that's just a general guide and not very thorough at all. If you do have some abnormal pain and movements like those, please contact your GP for a referral or see a physio for a more individualized and thorough examination. Okay, so back to that overuse and degeneration of the muscles I talked about before. We generally classify rotator cuff overuse and degenerative muscle injuries into 3 stages, which can be correlated to your age. So stage 1 rotator cuff pathologies normally occur from acute trauma, like a fall, or an acute episode of overuse or compression. And this can be generally seen in ages about 15 to 25. An example of this in baseball could be a young pitcher who normally throws about 60 pitches a week, has a tournament coming up, and over the weekend he throws 120 pitches over 3 days. So the muscle is not going to have enough time to rest, recover. Think of it like you've just come back from holidays, you've had a long, hard day at work, and then in the morning your alarm clock goes off at 5 a.m. and you remember you got to go back. The muscle is not going to be very happy, it's going to be irritated, so there's going to be some pain, maybe some inflammation. The muscle is going to be a little bit sore, just because it's not used to that sort of work. Good news is these muscles in stage 1, if there's an injury, they respond very well. They're just going to need some general rest, recovery, and then some gradual, slow reintroduction of load. So stage 2 rotator cuff muscle pathologies, this is more generally a repeated over many years, repeated overuse, compression on those rotator cuff muscles. And this could be seen in someone like a painter whose occupation, obviously they're going to be using their arm overhead for many years, where those spaces in the shoulder we talked about, they're going to be getting compressing on those muscles that are active. This age group is normally about 25 to 40, and this is where you're going to start to see some mechanical changes in the muscles and the tendons. So you might see some scarring, there's going to be some inflammation around the shoulder, and you might actually see some changes in the tendon itself. So think of it like if you buy a new rope, a piece of rope, it's going to look pretty good, it's going to be very strong, but then naturally after a couple of years it's going to start having little bits of pieces frayed. It's not going to be looking so good, but it's still going to work pretty well. That's what our muscles are like in our shoulder. As we start to age, again, it's a natural process. If you're seeing a physio in this stage, again, it's going to be pretty effective. They might get you on a program of deloading some of the muscles, tendons in your shoulder, just to try and give them a little bit of rest. We're going to do some active rest and then a slow reintroduction of load again. They might also look at your biomechanical issues or errors you may have. So if a pitcher is throwing with a really weird technique, incorrect form, they're obviously going to be more prone to injury than others. And a physio might also look at your training technique to see if you're training way too much in a short amount of time, as this is also going to put some more strain and make you more prone to injury getting more severe like this. Finally, stage 3 degeneration normally occurs from about 60 to 65 plus, just from years of natural aging processes and possibly even just overuse and compression over a very long period of time. This is where you might start to see some tears within the muscle. There might be some problems with other structures around the shoulder, and it's definitely when you should be consulting a physio to see if conservative management or surgery may be the best option for you, along with some medical imaging. You might have some pain just generally moving around into different positions with your shoulder. And then you might start to have a loss of range of motion in movements as well, which is again where you've got to debate conservative management or surgery. But if your quality of life is being impacted, then definitely speak to a physio and see what your path should entail. Okay, so moving on now to how to treat these injuries with exercises. But first, please remember, I am still only a physio student, only in 3rd year, so I'll just be providing a basic idea of what exercises a physio may prescribe to you upon seeing them. But please go and see a physio first. But these are just some general exercises that you may receive. Treatment would firstly to be address pain and addressing biomechanical issues or errors with movement. So a physio might look at your form and try and find out where in your movement you're getting pain, and if that's because of a issue with your movement. So they would first address this. So this first exercise is going to help with protraction of your scapula, or moving it around to the front. And what you're going to be doing is just lying down, making a fist, and just trying to punch up to the roof. This one, you'll have pillows under your armpits, and you're going to do a shrug movement. Try not to do it half-heartedly. Really try and retract your shoulder blades and shrug up and feel that contraction in your upper traps.